Hi, and welcome to Total Joint Talk with Dr. John Stelmach and Shanna. We're with Commonwealth Orthopedic Associates. And if you're watching this video, you've most likely seen me and been scheduled for surgery. I know when patients get scheduled for surgery, a lot of times that's the last thing you hear and you have a lot of questions. So we figure what we would do today is talk about a few things that you'll have to do before surgery in order to make the transition a little bit smoother. You get things scheduled, you don't have to worry so much because it's a big decision for you, and we know that. We just would like to try to make you more comfortable and have a resource to go through. Once I've seen you and discussed the surgery, one of the first things you'll need to do is to get cleared by your family doctor. So that's something that's a little bit confusing. So I'll let Shanna take over here for a second and describe what you have to do to get that. Shanna, what do they got to do?
Well, the first thing is if they've seen any specialists. So we have to make sure if you see respiratory or cardiac that we get you cardiac and respiratory cleared first. We need to make sure that you're a candidate for the Surgical Institute since it is not an actual hospital setting. Once you get those clearances, then we would pick your surgery date and we would get your pre-admission testing and your medical clearance within 30 days of surgery.
So you'll help the patients get those appointments?
Yep, I coordinate everything. A lot of patients get excited and they want to schedule things on their own, but I like to make sure that I schedule it that way everything is within the time frame, and I will coordinate everything and be in touch with the patient with their appointments.
And when are these appointments usually scheduled before surgery? Like
within 30 days, usually within 2 to 3 weeks of surgery.
Okay. The other thing we like to get is a dental clearance, which patients that get routine care is very, very simple because you've had routine dental care. So if that dental clearance hasn't been obtained, what do? Do you help them find a dentist? Because a lot of people don't have a dentist.
So I always say check with your insurance. We'll look at their insurance. If they have Medicare, pretty much they can go anywhere. If they have a specialty insurance, I always check with the insurance company, see where you can go, get some get a list of places, and I can give you recommendations as to where they can go for a dental clearance.
And usually my perspective is that if you've seen the dentist within 6 months, that's okay, as long as they've checked you out. Yep. And that's usually not too much of an issue.
Yep, and most people do go with every 6 months. So if you've been there within 4 or 5 months and your appointment is after your surgery, I tell patients not to worry. I fax the form over, and 9 times out of 10, the dentist will clear them based on their last appointment if they routinely go.
And just so you know, we're not doing this to be a pain in the neck. We're doing this to try to help you get through the surgery uneventfully, because infection is one of those things we just want to avoid at all costs. So it is important to do that. The other thing that people worry about is getting blood work.
Yes.
And what other tests they need.
Yes.
Now, what kind of tests do they need usually?
When they go for their pre-admission testing appointment, I say it's a one-stop shop appointment. They get their labs, their nurse assessment, they meet with anesthesia, they get their CT scan for their Mako, and their EKG if they have not been cardiac cleared.
And that's done
all at the Surgical Institute of Reading in the back of the building, and
before surgery, so it's within the 30 days
again? It's within 2 to 3 weeks of surgery, yes.
Okay. Now, will they see their family doctor before that, or how does that?
So we like them to have the pre-admission and testing appointment first. That way your family doctor can review all of those results and make sure that you're medically cleared to proceed with surgery.
Now, the tests that they're going to get, I mean, everybody's a little bit different, but just your routine patient who is just generally healthy, what sort of things are they going to have to get?
So they're going to have to get a CBC, a BMP, a PT-INR, a PTT, a sed rate, and a uric acid.
Right, and those are blood tests to get.
Now, yep, and then they get the EKG just to make sure there's no abnormalities with your heart. The CT scan is for the implant so that you can do your thing with that. And the nurse assessment is just to go over your home, make sure that you have a good support system after surgery, whether you're a candidate for inpatient therapy, in-home therapy, things like that.
And one thing that is a little bit of a change is that we no longer require a chest x-ray.
Yes.
Or your analysis before the surgery.
So that's good.
So we don't have to do those things unless there's a reason to do them. Now, the one other thing are specialty clearances. Now, a lot of times people have a cardiologist, had a heart attack, or that sort of thing. So is that something that you help them arrange?
Yep, so I like to do that first. So if they see cardiology or respiratory, I like to get the clearance first, because what would happen is we would get them cardiac cleared and they would get to anesthesia and they might not have been a candidate. So they would have went through the whole scheduling process just to find out a week before surgery that it's canceled. So I like to make sure we get their cardiac clearance. And then I run it through the nurses at the Surgical Institute. They run it by anesthesia. It literally delays the scheduling process by usually 1 to 2 days. So it's not a big, you're not waiting a long time. make sure anesthesia clears you, and then we can schedule your surgery.
Right.
And it's been working out really well, and nobody's been canceled. So
Good. That's important because as a cardiologist, it is important. There are a lot of medical problems that people can have that you really don't know you have. So everybody thinks they're healthy, but it really is important to go through these things.
Absolutely.
We want this surgery to be no big deal, and that's what this is an effort to. Now, the other thing that patients have to do before surgery is an anesthesia visit or clearance of the anesthesia people.
And that's
how does that work?
That's at the pre-admission testing. So when they go for all their labs and everything, they do meet with anesthesia at that visit as well.
And there are, just to avoid some frustration, sometimes the anesthesia folks do go through your case before the surgery, and occasionally we'll find things that is a question. That's called double checking. That's what we do. So if some of those things might arise, don't be alarmed. It's in your best interest. And Shanna and the staff over at the Surgical Institute will communicate that to you. So just be patient with that. We're really trying to have a non-eventful operation for you. And just so you know, the surgery is usually done over there, and we do a spinal anesthesia. So that's why some of these clearances need to do. Now, the thing that comes up with that, people are on blood thinners and that sort of thing. So we have to be very careful with that. The more common ones would be like a medicine called Eliquis, which is a blood thinner. Now, what I understand in speaking to the anesthesiologist is that needs to be stopped 3 full days before your surgery. Not like you take it the morning of your 3rd day before surgery, but you have to skip that dose. So that's 3 full days. That's very important to do that.
Yep.
Or if you're on other blood thinners, there are some other ones that we
Yep, there are some other ones, and we always, prescribing doctor, we always attach a form to the clearance, and please advise on when to stop if there's any bridging that needs to be done and things like that, so it stops safely for every patient.
Right. And then you'll show up the day of surgery at the Surgical Institute, and that's when they take over. And again, we like to try to make this as simple a process as we can for you, but there's a lot of things that you haven't thought about, and you're just worried about the operation, family members, and that sort of thing. And we can certainly help you with that. I guess maybe the one last thing that everybody would like to know is about going to rehab after surgery. I hate to say it, but I don't have a lot of control over that. A lot of it's criteria prescribed by Medicare and those sorts of things, how you're doing. So we really can't schedule you to go to rehab. I always think it's better to go home anyway if you're able to do it safely, because at that point, you're back to your own environment, somebody can help you. So in the rehab, it is an option, but it's hard to count on that because hopefully our patients are doing too well that really don't need that. But, well, I'd like to thank everybody for viewing in, and what we'll do is have some more videos coming out as we get through this one. This is our trial run, so hopefully you got some information and you're going to go through your surgery uneventfully.